I want to talk about something that I hear often from a lot of the women that I work with that are going through fertility treatment and some of the challenges they're having with their spouses or partners. One of the things that I hear happening a lot is women are sharing how hard it is because their partners or spouses are complaining that they're either negative, that they're thinking the worst case scenario, that they're not as hopeful. I want to make it really clear that that's normal. When you're going through fertility treatment, it is normal that anxiety symptoms are going to really increase. And what comes along with anxiety symptoms are a lot of rumination that can lead to negativity, irritability. When we're really worried, we try to think about the future and think of the worst case scenarios as if it's going to prepare us for it. Now we know logically that's probably not going to work, but emotionally it's just a really hard thing to avoid. For some people, they're so anxious that they want to think of the worst case scenario also to think about, well, if this doesn't work, or maybe it didn't work before and it might not work again, I need to think about plan B, C, D, E, and F after. Whatever someone is doing, please know their emotional reactions are normal. So I'm going to give you 4 different things that I need you to do when your partner or spouse is sharing information like this that's indicating there's some anxiety going on. Step 1, I want you to say, wow, you seem really negative today. I can see that you're thinking about the worst case scenario or the what ifs. You must be really scared. Just seeing it for what it is. Anxiety is rooted in fear. So name it. There's nothing better than when you're emotionally overwhelmed is to be seen by somebody else. 2, I want you not only to see them, but I want you to validate it and say, and I can absolutely see why you would be thinking that way, feeling that way, that makes sense to you. You might not like it because no one wants to see their partner in pain or spouse in pain, but you can see why they might feel that way. Fertility treatment, there's no guarantee. It's really overwhelming physically, emotionally, and even cognitively. There's a lot of decision making. Okay, so we're going to see someone, we're going to validate someone, and the next step that I want you to do is I want you to join them. I bet deep down inside somewhere you're also scared too. And I'd like you to go to that place, even if you're feeling hopeful that there might be some fear in you too. Go ahead and join them. Fertility treatment can be so isolating, and no one certainly wants to be isolated in their own family. And last but not least, when asking your partner or spouse, when you're scared, what can I do that can help you feel emotionally safe? What can I do to support that? Do you need a hug? Just find out what it is. If there's anything you can do in that moment. And even if the person says, I don't know, say, okay, no problem. I'm going to keep checking in on you today. Of course, follow along for more. Share with someone you love.